Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
All right, we're back for another episode of the Healthy Chicago podcast. I'm your guest host today, Dr. Alex Sloboda, Medical Director of Immunizations and Emergency Preparedness at the Chicago Department of Public Health. And today we're talking about the new and amazing Pilsen South Ashland Health Hub, which is located at 1713 South Ashland Avenue in the heart of the vibrant Pilsen community. To speak about this new health hub, we have a wonderful guest from CDPH with us today, Jeanny Masso, and I'll let them further introduce themselves.
Thank you. Thank you for having me. My name is Jeanny Masso. I am one of the therapists out of the mental health clinic, so the Pilsen South Ashland Health Hub.
Perfect. Well, it's good to have you here. So can you tell me more about the opening of the Pilsen South Ashland Health Hub and specifically what you do there?
Sure. So like I said, I am one of the therapists there. I'm one of 6. There is 6 bicultural, bilingual therapists there, so it's very kind of unique in our clinic. We had our grand opening actually the 20th of November, so it was amazing to finally have a ribbon cutting and have everybody come and see what we've been working so hard towards, so it was amazing. But I provide individual and family therapy there. So I provide therapy in English and in Spanish and in Spanglish for our bilingual family. So if the parent speaks Spanish, the child speaks English, it's a lot easier for them to actually come and seek services from us because we're able to treat not just the patient, the client, but also the family as well if that's needed.
Oh, that's awesome. Yeah, and I was there at the grand opening, and it was a great event, very, very well attended. The mayor was there, media, so it was a big celebration. People were really excited about that. So can you tell me more about the services that will be available at the Health Hub?
Sure. So from the mental health aspect, which is mine, we're going to be doing, like I said, a lot of different therapies. So individual, group therapy we're going to be starting, couples, family, and then we're also going to be having our nurse practitioner who we have there 5 days a week to provide medication monitoring. So any psychotropic medications that our clients are going to be needing, they actually can get it there as well. We have a public health nurse who's there as well. So any medical screenings, any referrals for any kind of medical procedures, they're able to do that there as well. So we're really trying to treat holistically for our clients. And that's really what our vision is that we will treat every part of what they need. And they're going to either get it from us or that we're going to partner with someone else. So for our medical, we have UI Health there, which has been a great neighbor to us and a very welcoming neighbor for us. Yeah. So they can get their medical care through UI Health if they don't already have a PCP.
Awesome. No, that's perfect. Yeah, especially when it comes to mental health, it's really important to be very holistic and cover all the bases because a lot of aspects of life can really impact your mental health. So that's amazing.
Absolutely.
And obviously this is one of many health hubs that are either open or going to be opening in the city, but this one specifically in Pilsen on South Ashland. So what do you think specifically about this health hub? What does it mean for the surrounding community of Pilsen to have this health hub there?
I think it's incredibly important because we really are a safety net type of model. So there is no barriers for our clients to get treatment. We can have treatment in person when you come into the clinic, or we can do things over telehealth. So we can do video call sessions, we can do telephone sessions, because we understand that our clients have busy lives and they're going to be going from work, family, kids, sports, everything else. We want to be able to make sure that if we are going to provide a service, that it is going to be no barriers. So regardless of documentation status, language, you're going to be able to come to us and we'll be able to help you out.
Yeah, no, that's great. I was a little hesitant about telehealth at first, but even myself using those types of services, I found it really useful because
absolutely,
like you said, you're really busy. It can take time to travel in person to a clinic, and especially if you have to take time off of work and stuff, it's really helpful to have that option to either do that at home or somewhere else. To save some time. So that's a great option for sure.
Absolutely. And especially because a lot of the clinicians there, we specialize in working with kids and adolescents. We understand that parents don't live in a bubble and you have siblings, you have sports, you have everything else. So it's really helpful for them when they're able to just say, okay, here's a private area. Turn on your phone, your tablet, your computer, and here, have therapy. So it's been really great. We learned over the pandemic how great of a service and an asset that could really be. It's awesome to be able to continue to do that work now, especially in an era where, like I said, families are busy. parents can't always, to your point, take off of work, miss school to come see us. So to be able to have that as a supplementary service is amazing.
Yeah, no, that's awesome. Can you go a little bit more in depth about the mental health services available at the Pilsen Health Hub, and just like why in general should people be seeking mental health care or support?
Sure. So like I mentioned, we're doing individual, we're starting up our groups, we're doing family work as well. We're actually going to be doing our healing arts program is going to be an extension there as well. So we're really excited about that, to have art be part of the treatment that we also provide there. Having the art support groups is amazing. I was at a site before this that had it, and it was awesome. The clients really loved it. So I'm really excited to have that now be at the Health Hub. But as well, we also want to have like more than just therapy. So we want to make sure that we're touching on everything. So like you mentioned, right, the physical, the environment, everything really plays into the person's well-being overall. So it's amazing that we're able to have different disciplines as well work with us.
Yeah, no, just being in the space itself is really like a healing environment, just like how it looks, and very welcoming and very calm. Can you tell me more about kind of the art therapy aspect? Can you give some examples of what that might look like for people? Or
so from what I've seen, we do have someone on staff right now who's actually a registered art therapist, which is
great.
really exciting. So we get to collaborate a lot with her. And then coming in the next year, we're going to have, like I said, the healing arts program is going to be based, also have a base out of our site. So that's going to be awesome because we get to work with them, and it's not only open to our own clients, but I've also seen it be open to the community. So Pilsen will be another great asset to that. So it'll be great.
Awesome. And I know today our focus is kind of on the Pilsen South Ashland Health Hub. Are there any other CDPH mental health centers or health hubs that provide mental health services in the city?
Yes, there's actually 5 other sites apart from our own that are open all across the city. We're actually excited that Roseland will also be joining us soon.
Awesome.
So at the end of this month, we will be opening up the Roseland Health Hub, which is going to be the same model where we treat clients holistically. We're going to have a lot of different services. So at ours, it's the immunization clinic is there. WIC will be coming to us in the springtime, which is awesome. We have the UI Health there for our medical needs, and then we provide the mental health and therapy services. Roseland will work much in the same vein. So it's amazing because that's kind of what we feel like is the best way to kind of treat, is that you're not just thinking about one little bubble, you're actually touching on the person in the environment and taking everything into consideration. Because we know that if you're not sleeping well, you're not performing well, your health is then you're going to get sick, especially this time of year. It's flu season, it's cold season. If you're not taking care of yourself physically, mentally, you're going to suffer. Everything is all connected. So it's great that we're going to have this model. And I think especially someone who has a long history of working with community mental health centers, I know how important it is to make sure that, hey, are you sleeping? Are you eating? Are you seeing your PCP? That's really important for me to know about, because I need to kind of get a very big picture of like what's going on with you. So even though I'm one sliver and one provider, I do like to know what's going on elsewhere.
Yeah, no, it's really nice when you can have, like kind of physical health and mental health kind of together, working hand in hand, because sometimes there's a mental health issue might be going on, but giving you like physical medical symptoms, or there might be a medical issue going on that's causing like mental health stress, depression, anxiety, and things like that. So it's really important to kind of have both of those aspects dealt with together. So.
Absolutely. Yeah. So we're excited to have Roseland join our ranks and also be the Health Hub model. I think that's a really important aspect that we haven't really seen before, and it's really awesome to be part of that new team that we're kind of bringing in that idea. So we're ready and we're excited.
Awesome. So something I'm actually really interested in and have been hearing a lot about is trauma-informed care. Can you explain more about what that means and how emotional trauma can impact someone's mental and physical health?
Absolutely. So we know that there's a lot more studies coming out. We're becoming a lot more educated around, yes, it could present itself as an anxiety, as a depression. What else could it be? Because that came from somewhere, right? So when we're talking about treating someone, and we want to make sure that we as providers are understanding that this is, again, not just one little piece of what's happening, but we need to consider everything else, your environment, your history, everything that's going on with you now, so that we're able to meet you where you are. And I think that's incredibly important, especially when you're having a relationship with your therapist. It's an incredibly intimate relationship, and you need to be able to trust me, and I need to be able to trust you. So in order for me to do that, I kind of have to know what's going on, and I have to gain your trust, because how else am I going to help you? How else are we going to build that relationship? And we know that the therapeutic relationship has to be really strong in order for you to actually get something out of therapy, because we can have all the manuals and all the wonderful things in the books, but unless it really makes a connection with the person, you're not going to come back to see me. You're not going to come back to therapy. And that's the last thing that we want, is for you to have a negative association with therapy. So I think something unique about, especially the group that I work with at Pilsen, is that our biggest challenge, especially being in Pilsen, is breaking those generational stigmas about mental health. We work with a lot of Latino families, and a lot of the time we have that negative stigma of mental health, right? Are you, right? There's not exactly a translation even for the word therapist in Spanish. They say psychologist. I'm not a psychologist, I'm a therapist. There's a really big difference, right? But they consider, oh, are you a psicóloga, psychologist? Nope. Terapeuta, terapista. That's kind of what we call ourselves, right? So I think it's really important, especially in Pilsen, for us to challenge those generational stigmas of mental health is not a bad thing. You're not crazy. Something's going on, right? Back to the trauma-informed care. If we look at it through that lens, it makes it a lot easier for us to say, okay, something is going on here, and we really have to think about what's going on in the environment, you as a person, your medical health, your physical health, what's going on, so we can help you get to where you want to go.
That's amazing. And so a lot of times people will have traumatic experiences in their life, and sometimes they don't even register that it was like a traumatic experience. Like, what are some of the symptoms that someone might be experiencing that's had trauma? Sometimes it may be diagnosed as PTSD or something else, but like, what are the symptoms people may want to look out for, and maybe make a connection that, oh, this might be from a traumatic experience I've had a long time ago or recently?
So it's really hard because everybody is obviously, and it's an individual case, right? But definitely, I would say some of the things that we see, especially with our teens and our kids, which is what I usually kind of pick up on more. I do work with adults, but teens are kind of my bread and butter, is anger. A lot of the times, the disciplinary issues that you see in school, the issues at home where they're really angry, they kind of exaggerate a lot of like that startled response. That's kind of a clue that, hey, something's going on. A lot of the times, a teen's MO is like, let me lock myself in my room and don't talk to anybody or be on my devices. And to an extent, that's fine, right? But when you're starting to do that every day, week after week, that's where we're kind of more of a red flag that we're like, okay, something's going on. Especially if someone is going inward, that's a huge red flag, right? But also people that are extremely extroverted, that they're going out all the time, that they feel like they're going to miss out on an experience, that they have to be everywhere all the time, always on, always perfect. That's also a red flag that something is going on, right? So it's anything that, as a parent, you're going to know that something kind of, like the kids say, the vibes are off. Something then is going on, and that's where we kind of have to go, okay, let me pay attention a little bit more to this, because it is something that's really important. And like you said, it's going to manifest itself in different ways, but I think those are most of the common ways that I've seen with something is happening, is that they're either going inward or they're just being very uncharacteristically extroverted.
Yeah, and I've seen that with especially when you're talking about like anger and stuff, young people. There's a lot going on in the world right now, a lot of traumatic experiences, and a lot of times maybe an educator who really cares about the individual or a healthcare worker that really cares about their patient may see this anger and just be like, oh, this young adult or this teenager doesn't care, or they're not engaging with me. But that's kind of what the trauma-informed care is like going past that. It's like, why is this happening? Why are young people or teenagers like acting out in this way and trying to address that issue? So it seems really important.
I think you hit on a really big piece, which is patience, right? I've had clients over the years where we sit for an hour and stare at each other. And it goes on for days, for weeks. but I'm there, right? I have to be there, and that's part of the trauma-informed care is that I'm going to show you that no matter how much you push me away, you ignore me, you don't want to be here, okay, I'll be ready when you're ready.
Yeah.
Like I tell a lot of my clients, I'm your co-pilot choosing the music and telling you, hey, we can go right, we can go left, we can keep going, but you're the driver. You're the one deciding how fast we go, how slow we go, where exactly we go, because it really is about you and where you're at, and then I'll help you get to where you want to go to, but you're the one driving the car.
Nice. No, it sounds like a lot of great work going on at the Pilsen Health Hub. Is there, so if someone, and a lot of times it can be hard to like even recognize that you're having mental health issues or struggles, and that's in itself is a big barrier to come over, as well as getting to the point of seeking care can also be very difficult for many people for various reasons that we've kind of talked about. But even if someone's to the point of like, there's something going on, this is really, I have a lot of stress, anxiety, depression, anger going on, how do they go about seeking these services? Literally, how do they go about seeking the services at Pilsen Health Hub once they get to the point of like, I need some help and support with this?
Sure. I mean, they can give us a call. So we have our central intake, and we're open 5 days a week with that. So you will get, if you call the line, you'll get an intake therapist who's going to ask you a bunch of questions, of course, but is also going to try to help figure out, okay, are we interested in individual therapy? Do you need family therapy? Where's your address? So that way we can figure out which clinic is going to be closest to you. Do you prefer in-person services over telehealth services, right? So we're going to try to ask those questions to figure out where exactly you are and where we can fill in the gap and help you out. More to the Health Hub model where it's like, okay, where are those deficiencies? Where are those things that you need? Let's see if we can help you out. Where can we fill in that gap?
Yeah, trying to make it as accessible as possible and
Absolutely.
overcoming barriers. No, that's
Yeah,
great.
that's definitely one of the unique things about us is, again, regardless of insurance, regardless of documentation, we will be there to help you. That is the point of our clinic, is that we have no barriers for people seeking services.
Awesome. And then obviously we've mentioned that there are other services at the Health Hub. So I am the medical director of immunization, so I will put in a plug for that as well, because immunizations are important to keep us healthy and safe, and honestly prevent some trauma as well from some of these diseases that can be very severe. So the CPH immunizations program also is at the Pilsen Health Hub. They are there Thursdays and Fridays at the same time, starting at 8:30. It's 8:30 to 4:30 are your hours there?
Yes, and then we have 2 late nights until 7:30.
Oh, okay. Awesome. But for the immunizations, we provide free childhood vaccinations for children that are uninsured, underinsured, Medicaid, CHIP children. And we also have immunizations for and underinsured adults. So obviously these are really important. We've had a busy year this year of a lot of different types of infectious diseases and outbreaks. We all remember measles this spring, so it's really important to make sure you and your child have the MMR vaccine. Chickenpox has been going around, so there's a vaccine for that. We've been hearing a lot recently about whooping cough or pertussis, so there's also a vaccine for that to prevent these things from happening. So yeah, and you can come for both. You can come for your mental health appointment, and then while you're there, make sure you and your children are up to date on vaccines. Many of these are required for school, but also you just want them to stay healthy, protected. And also this time of year, it's viral respiratory season, so we got COVID-19, we got flu, we have things like RSV going around, so we also have free updated COVID-19 and flu vaccines for anybody in Chicago, regardless of insurance status or any other statuses, can come in and get those COVID and flu vaccines. They're updated, so we know COVID-19 is changing, flu is always changing, there's new strains going around, so even if you've had other flu and COVID vaccines, you got to get this new updated one. So yeah, please, while you're stopping by for these great mental health services, also just get your vaccines as well. It's pretty quick and easy, and it's free. So I think we've covered a lot. Is there anything else that I missed, or anything else you want to share about the services there, or just kind of mental health services in general for CDPH in Chicago you want to talk about?
I mean, think it's really important, like you said, to get the word out there that we're open. We actually have availability for immediate sessions. So if someone, especially with the holidays coming up, families,
Tough
like
time
you said,
of year.
trauma is always around the corner, it feels like. So if you are someone who is looking for services, then you're more than welcome to come to our clinic. Like I said, the phone number is 312-743-7500. So you can give us a call, say, hey, I'm interested in your therapy services and your mental health services, and we'll be able to get you in immediately with our nurse practitioner who's there for the medications, as well as the therapists that are there to provide.
Awesome. Wonderful. And before we wrap up this episode, what is something you're looking forward to doing this December? I know there's a lot of holidays going on. What are you looking forward to in life?
I am actually looking forward to spending my niece's first Christmas with her. So she's about to be 3 months old, actually. So I'm really excited. To your point, she's got her vaccinations. We got her covered. But I'm really excited to spend the first Christmas with her. She's the first one in the family, so I'm excited.
Awesome. That sounds...
What about you? What are you looking forward to?
I'm looking forward to getting a little bit of rest. It's been a busy year, so just being able to take a little time off, spend time with family and friends, and it's been a while. So, yeah, it's a good time of year for that. So, but also just that's always a good reminder as well. It's important we all want to spend time with our loved ones, families, and friends this time of year. So it's important to take care of ourselves mentally, look out for our mental health, and also get our vaccinations so that we don't get sick and we don't get our other people, family, friends sick as well. So, but thankfully you can go to the Pilsen Health Hub and get all that covered. So
we're ready.
Yep, we're ready. So I'm sure we'll be talking more about the many new and expanding health hubs in the city of Chicago. We already talked about the Roseland that's coming up, and there's more in the future as well. So please keep an eye out on our website and socials for more information. But thank you so much for joining me today, Jenny, and all your insight you provided about the new Pilsen South Ashland Health Hub and the services we provide there for the city of Chicago.
Thank you for having me.
Yep.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.